Hello everyone, my name is Jennifer Lutz and I'm here to talk to you a little bit about car seat safety. First, I want to tell you my resources. I used the American Academy of Pediatrics website. I did an interview with a licensed car seat technician and her name was Jessica Geiger. And I also used the Insurance Institute for Highway Safety website. A lot of you who were born before or during the 1970s were not placed in a car seat, and nowadays we would not imagine putting our child in a car without a child safety seat. Tennessee was the first state to enact the child safety seat law in 1978 for children infant to 4 years of age. By 1985, all 50 states had endorsed the law that children had to be in a child safety seat. According to the Insurance Institute for Highway Safety website, children in the state of Indiana must be in a car seat until the age of 4 in a harness until the age of 7 in a booster or 57 inches tall. I interviewed a woman who is a car seat technician from Idaho whose name is Jessica, and the Idaho law states that a child must ride in a car seat until the age of 6 or 60 pounds. Child safety laws are important because car accidents are the #1 cause of death in children ages 1 to 14 and the #2 cause of death in children under the age of 1. There are a few types of car seats children ride in under the age of 1. There's the infant seat, and then there's the convertible seat. Most parents choose to put a child under the age of 1 in the infant seat only because it's handier and you can take it out of the car. For both seats, they are to be sitting backwards facing towards the back of the car. And for rear facing, the harness should be at or below the child's shoulders. And forward facing, children can forward face at the age of 1 or 20 pounds, and the harness should be above or at the child's shoulders. With the harness, you want to make sure it is tight enough, and a person should not be able to put any more than 2 fingers under the harness when placed on the child. Another way to see if it's tight enough is it's called a pinch test. You pinch it lengthwise, and if it's pinchable, it's too loose. The chest clip should be armpit level on the child when placed in the car seat. Although it is not a law, extended rear facing is suggested and is safer. It is suggested to prevent the C1 and C2 vertebrae from breaking, which can cause internal decapitation in an accident, and it is overall safer. For comparison, if an adult were to get in an accident and get whiplash, it would be like having a 20-pound head. The American Academy of Pediatrics recommends that you keep your child rear-facing until the age of 2 or older. Some state laws say that it's okay for a child to be facing forward at 1 year and 20 pounds, but AAP says that is the bare minimum. Please do not face your child forward that early. Some of the recommended car seats for rear facing are Graco, MyRide 65, Compass TrueFit, and Sunshine Radion. They all rear face to either 35 or 40 pounds. If your child is between the ages of 4 and 7, by law, they are supposed to be placed in a child's safety seat. Why not keep them protected longer and harness them longer? If you are not sure if your child is ready for an over-the-shoulder strap in the car, there is a 5-step test you may do. Number 1, does your child sit all the way back against the seat? Number 2, does your child's knees bend comfortably at the edge of the auto seat? Number 3, does the shoulder belt come across the shoulder between the shoulder and the neck? Number 4, is the lap belt as low as possible, touching the thighs? Number 5, can the child remain seated properly for the whole trip? If you can say yes to all these questions and are comfortable placing your child in a booster or just using the lap belt, then go right ahead. But if you cannot say yes to all these questions and are not comfortable, the best place for your child is to be in a harness to be safer in a vehicle. Some of the recommended car seats for extended harnessing are the Graco Nautilus, which is a forward-facing car seat only, the Graco MyRide 65, and the TrueFit. Another safety measure the AAP is suggesting is not to put your child in a bulky coat or anything that interferes with the harness, because in case of an accident, the air in a bulky coat could compress, leaving too much room between the child and the harness, and the child could come out of the car seat too easily. In any case, to keep your child warmer, you may use the coat backwards on top of the harness, or you can put the harness underneath the child's coat. In a car seat for infants, you can use one of these, which is a shower cap cover, and it slips over this type of car seat. Or you could use a Bundle Me by J.J. Cole, but if you use that type, the Bundle Me, you want to make sure that you cut out the back so that it does not interfere with the harness. In conclusion, car seats have been shown to be extremely effective in reducing death and injury in infants and children due to motor vehicle accidents. According to American Academy of Pediatrics, car seats are 71% effective in reducing death in infants, 54% effective in reducing death in children up to the age of 4. Belt positioning booster seats decrease the risk of injury by 59% for children ages 4 to 7 years. So please keep your children safe and make sure you have your car seat buckled in the car properly. And if you have any questions, you can go to your local hospital or fire department. Thank you.